patient with DKA would need? Well, if they're not on insulin, we got a problem. Critically thinking, we got a problem, because DKA means, and you had this last semester, DKA means the patient has a blood glucose, if they have DKA, somewhere between 500 to 1,000. That's what the literature supports. So therefore, I shouldn't have a patient with a 500 to 1,000 blood glucose. So insulin should be given to that patient. And if they have DKA, they probably should be in critical care, because it should be an insulin drip. And that means I should be doing hourly glucoses, which comes over here to the other side. There's a place to say, what therapeutics are you doing? Hourly glucose checks. So if I made DKA yellow, then my insulin would be yellow, and so would my blood glucose checks. And even if I was doing hourly urinary outputs, which I should, even if I was giving normal saline to fluid resuscitate, which I should, those would all be highlighted in yellow because they relate to DKA. Now, if my patient also has underlying hypertension, then that would be a secondary diagnosis. So hypertension would be a different color, and then all the antihypertensive medications would be in a different color, the same color as hypertension. And then if I do blood pressure checks every 4 hours according to unit protocol, or every hour if I'm in critical care, if they're in hypertensive crisis, then that would be the same color. Does that make somewhat sense? And then when I turn the page over, there would be a nursing diagnosis opportunity. And that should be the same color as one of those things. So I'd be prioritizing my nursing diagnosis according to what my patient's problem is. And so I'd make that the same color. And then I don't care about colors once we get down to interventions. I just want to have a nursing diagnosis related to whatever you're relating to as a problem. That's how I'm critical thinking. Does that make some sense, somewhat sense?
And the advantage of having a hard copy of this and highlighters at clinical is that you may, I'm having trouble, I know this is important, but I don't know why. That's what we're here for, okay?
We might know why.
If not, we'll find out.
Because we don't have to know everything. We just have to have resources. But thank God we do know everything, so we don't have to use it.
No, Miss Miller knows everything. I don't know, but I'll find out. It's a favorite phrase of mine.
I can usually find an answer. Okay, then there's this little problem called knock and nick. Everybody remember those from last semester? Not the LPNs. But knock and nick are very specific. Under your short-term goals, that's where your knock comes in. And under interventions, that's where your nick comes in. So what's important about that is it goes through and helps you determine interventions. I have to clear this out, I guess. No, because it's not going to let me do that. Okay, I'm coming. It's not good here. Close current tab. But you will note there's nick categories and knock categories. So when you have to figure out what nick you want to use, you go through there and you look at the list of nicks, and then you pick which one is applicable to that nursing diagnosis. And if you ever looked at your
Amanda, but
the book we have, the book we use for their nursing diagnosis. Who is that? Oh, Carpenito.
Carpenito, yeah.
If you look at Carpenito, everything is in there as neck and knock. We just never ever reinforced it till last semester. Okay? So there's resources that you have in your hot little hands that will allow you to see what in the heck's going on. So, but those are the categories, and then approved nursing diagnosis probably is not enough of these here, but I don't like you to think about 150,000. So I kind of narrowed down to ones that are effective for most of what we have this semester. Now some of these are out of I don't like actuals, and I'm not going to get into what you guys decide, but there's, if a patient's in critical care of the ED, there's probably a real problem that we could pick on, not just something that could possibly go wrong. I'd like you to think of what could possibly go wrong, because that's pretty good thinking if I'm thinking about what could go abnormal with this patient. But the point is, there's probably some actual problems that you should be focusing in on if they're being admitted to critical care.
And if they've been in the hospital 4 days, their admitting diagnosis, their chief complaint, may not be their primary problem anymore.
And you'll be shocked that we'll be able to figure that out.
So as a rule of thumb, no risk for?
No, I'm not saying that. If I have a patient, let's say that came in, let's say it's a medication that we've overdosed on and they have a risk for seizures. I think that's an applicable one. Risk for seizures could be a real significant problem that could be life-threatening. So I could say that, so let's say an electrolyte problem. So which one makes me at risk for seizures? This happened last semester. Excellent. Sodium, high or low. So if I have a patient with a major sodium problem, I could see that, but just don't fall back on all potentials, because that's easier. I think sometimes potentials are easier. Potential for. But, you know, we only want 2 diagnoses. You don't have to get crazy with this. We only want 2 nursing diagnoses per concept map, not 15.
And again,
2.
another reason to have it with, you know, this is what I think is this person's main problem. I just don't know how to put it down. Let us know.
Well, the issue is that should come out during post-conference. We can help you right there fine-tune what you need to be doing so that you won't have to redo concept maps. None of us want to read concept maps twice. Do any of us?
I don't want to read them first time.
Yeah, we really don't. It's not that exciting for us either. Believe me, we've lived these patients, so we don't need to read all your stuff on it. But the point is, we have to make sure you're following through. So the point, we don't want to see them twice. We'd love you. Ask the questions. Email us before you need to have them done. You're going to see her lots of times on Thursdays. So you can bother her.
Me.
Miss Stewart. Bother her on Thursdays.